Hi everyone, thanks for joining. We're going to get started now. Just a reminder, we have approximately 30 minutes and one question, one follow-up. And with that, I'll turn things over to Dr. Williams to get started.
Okay, good afternoon. May, and we're in the 17th. So we're looking back over the weekend, and we'll have some promising signs of directions going and data going in the right way, as well as we're looking forward to the week ahead. And of course, with the milder weather, cautions and concerns about people being bursting out a bit too much into spring too quickly, to be careful and cautious. We're still in this precarious time. So with that, I'm going to ask Dr. Yaffe to take us through the data and highlights and comments, and then I'll have some more comments to make afterwards. So over to you, Dr. Yaffe.
Thanks very much. Good afternoon, everybody. It has officially been a week since our last update. But as is customary on Mondays, I'm going to report on the daily numbers from over the weekend and today. On Saturday, Ontario reported 2,584 cases. On Sunday, we reported 2,199 cases. And today we're reporting 2,170 cases of COVID-19. So this is the 8th day in a row that we have recorded under 3,000 daily new cases. Our 7-day average is now 2,352, and that's down from 3,017 a week ago and 3,577 cases 2 weeks ago. We're reporting an additional 58 deaths since Friday, which includes 4 today. And that is the lowest number of deaths we've seen in a single day since March. But as always, we do extend our deepest sympathies to the families, friends, and caregivers of those who have passed away from COVID-19, and to everybody who's mourning the death of a loved one during these very difficult times. We continue to see improvement in the number of hospitalizations and intensive care unit admissions. Today, there are 1,320 people in hospital with COVID-19, and that is up slightly from 1,292 on Sunday, but down significantly from a week ago where we had 1,632 people in hospital with COVID. There are also 779 people in the intensive care unit now, which is down from 785 yesterday and 828 7 days ago. So the trends remain encouraging, but the numbers are still very high, and they represent people who are very ill from this disease. Our testing volumes were quite low yesterday, with only 24,498 cases or tests processed, which is a positivity rate of 7.9%. While this positivity rate is still relatively high, it is notably lower than the 9.1% reported last Monday. This is a metric that has been trending slowly and steadily downward in recent weeks, and our current 7-day average for percent positivity is 6.8%. I'm also reporting at this point a total of 14 cases of thrombotic thrombocytopenia, or TTS, linked to the Covishield AstraZeneca vaccine. And of these 14, 10 now meet the criteria for VIT, or vaccine-induced immune thrombotic thrombocytopenia. I want to take this opportunity to reiterate that those who have received their first dose of the AstraZeneca vaccine did absolutely the right thing to prevent illness and protect their families, loved ones, and communities. I would now like to turn it over to Dr. Williams for some additional remarks.
So as I reflect on the numbers that Dr. Yaffe has reviewed for us today, I'm, as I said at the outset, both encouraged, optimistic, but with some coming events ahead of us, I'm a bit concerned as well in that. It's good to reflect that a month ago, April the 16th, Ontario was at its highest daily number of cases ever at 4,812. So you can see that we have come a long way down. And this is to the credit of everybody watching, and many officials in that, and for those who've gone out and received their vaccine in the right time with the right organization. Our weekly case rate is now down to 124 per 100,000. A few months ago, back in the fall and the spring, we'd say only 124 per 100,000. That was high. And that still is well above where we dipped on our curve between the first and second and third wave, I should say, which we got down to 40 per 100,000. So we're not at the highest part of the second wave, but we're certainly not where we were when we started going up on the third wave. So we're making progress, steady progress, and very excellent work on bringing these numbers down. They are reducing week over week. As the numbers that were tested today that will show up for tomorrow, it looks like our positivity and the volume will make us perhaps even dip under 2,000 cases in a day, maybe. But we're going to see how the weeks go as the volume of tests go back up again. So as we see this happening progressively, we're seeing the numbers drop by anywhere from 200 to 500 week over week on the average. If that situation progresses and continuously works that way, we are certainly moving in a good direction towards the middle of June as we progress forward and looking at how we might see the summer unfolding ahead of us. So there's been a lot of work by everybody to get us to that part. The hospital data still, as noted in the data, is still up. That's in the mid 700s. We've moved back from the 900. We still have transfers taking place. We still have staff in those facilities working full out to look after these many individuals who are quite critically ill, dealing with not only the physical concerns, the long hours, and the emotional issues of dealing with family members and connecting with family of those that are in critical condition, and unfortunately some that are dying as a consequence of COVID-19. So we're not out of this by any means at this time. We've administered over 7.1 million doses of COVID vaccine. That's a tremendous job done by a lot of people in a lot of different ways. And that's because we have opened up many facilities, many different venues with our provincial booking system backed up by other systems that different agencies such as pharmacies and some health units are doing. Why? Because it's important that we record all these tests, we make a good record of it, and we're not losing track of those. That's also important because of our vaccine safety program that Dr. Yaffe's alluded to when she talked about those adverse events. We want to track every one of those, from mild issues of pain and soreness around the spot to allergies and to these unfortunately severe ones that we see now and again that are fortunately still rare but of concern to us as we go forward. So we want to continue to move on that. You're going to hear that at the beginning of tomorrow, individuals age 18 and over in 2021. Let me translate that. If you're 18 already in 2021, you can register. If you're going to be 18 in 2021, even if you're 17 at the moment, you can register. So just to be clear on that. And so that's exciting as we move into that. So we're getting more vaccine this week. We hope to get well over 1 million doses in different forms and varieties in there to facilitate our various mass centers, other centers, primary care, pharmacists, and hospital centers to get the vaccination done and to keep using all those up as soon as we get them in. And the next number of weeks, our volume is going to be considerably better than it has in the last number of weeks. So we're optimistic that we can keep pushing our vaccination rates up, hoping to get at least to 65% by the end of the month, even higher perhaps. And that will be a credit to all Ontarians as well as all those who are putting in hours, volunteers, students, other ones working at the various vaccination centers, doing dose after dose after dose in a way that people have commented saying, it was so well run. We were treated so politely. We were handled so carefully, and people were very complimentary of the various forms and formats. So thank you for those centers that keep doing it day after day and treating every individual as their first time, because this is a big event for some people. Some are just elated after they get their dose. Some are actually tearful and excited about it. So we want to make sure I want to make sure I don't forget about that, of the ongoing hard work by everybody to keep this program going and moving forward. The more we get immunized, the more our protection goes up. But remember, it doesn't work instantaneously. It does take at least 3 weeks to build up some level of immunity, and it keeps accruing and building as you have more time. That's why we're working at our second booking for the second dose of many of the vaccines and how to do that to get them at the most optimum time and to take advantage of those natural systems of immunity accruing over that time to get you ready for the best protection you can have. So we see that we are still moving forward with the stay-at-home order. at least up until the 2nd of June. And we continue to look at ideas around the new directions, what it's going to be after that, as we build up our immunity with vaccines in the community, as we get that out to all our different high-risk areas, hotspots in communities, different forms and formats, some workplaces, different locations, to try and get the best coverage you can as soon as we can to get those numbers, that protection up, and to get those numbers coming down as quickly as we can and decrease the load on our hospitals. So we need to continue to stay at home for that time. That means especially in this coming weekend, the long weekend. And our history, of course, in the past is that long weekends have not been the greatest time for consistency and performance around maintaining public health measures. And yet we've been experiencing this. I find that each time people seem to get a little bit better at it. They learn and understand what it means, and they know now, instead of like, I don't know where the end of the light is, the end of the tunnel is, they know the vaccines are coming. They know some of them have got the first dose, they're waiting for their second dose. So be really careful on this long weekend coming up. We don't need to have a big surge back up again. We don't need another whole cohort being admitted to our ICUs, because we're only down to the upper 700s. So we were working at how we're going to be compromised terribly at this 880 about a few weeks ago. We can go back up there fairly quickly. We do not want that to happen. So a bit more patience, a bit more time. We're really looking for, how's the summer going to look? And with our vaccines going the way they are, with you coming out in the right time and the right way, dropping our age down to 18 plus, more and more getting done. And then we've got coming up in the future, very shortly, our 12 to 70-year-olds also with more vaccine supply. So steady as it goes, as we say, and let's keep moving in that direction. So stay careful over this coming weekend. Enjoy the warm weather. Get outdoors. Do what you can with your household and family in that. Wear your mask when you're out in crowds. Keep the distance. You can still enjoy and have a great time out there, as this is our first real hit of, I would say, really solid spring weather into summer in that sense there. So enjoy it while you can, but enjoy it with care and caution, And let's look forward to a great June and moving into the summer in the future. With that, over to media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
First question from Mike Crawley at CBC News. Please go ahead.
Dr. Williams or Dr. Yaffe, are you investigating any possible deaths related to the AstraZeneca blood clots? Because we've heard a report that there is one that is under investigation.
Yes, I believe there has been at least one. We work together with Public Health Ontario and with the local health unit to investigate all possible adverse events, including any reports of TTS or VIT. As we said before, that is a very serious complication, very rare, but very serious. So those are investigated. And of course, if the individual dies, we work as well with the coroner.
Sorry, I think I need you to clarify. Is this I'm talking about a new death. Is there currently an AstraZeneca linked blood clot death in Ontario that you have not reported yet that is under investigation?
I am not aware of that because when they're being investigated, we only get advised when it looks like it is meeting the case definition. So I'm not aware of that at this point.
And I would add, Mike, that when we get these reports, there is a fairly comprehensive process that goes through with reviewing all the details, including that if there is coronial investigation to ascertain if it is directly linked to the vaccine with a so-called vaccine-induced thrombotic thrombocytopenia, and the lab tests accordingly. So everything must be taken carefully, and before we'd want to conclude on that, we'd have to wait for the investigation to be totally completed in that before we made that assertion. But if there is, we're going through that process, and we will endeavor to get the answers back as soon as we can, and with respect to the family members, of course.
Next question.
Next question from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, doctors. This morning, Health Minister Christine Elliott was saying that if you're good with opening golf, tennis, those kinds of things, that she is too. So given your cautions earlier, are we still a ways from that? Do you think it's possible by June 2nd? What do you think is in the cards, and how do you feel about that right now?
Well, thank you, Rob. And what we're trying to look at with our public health measures table is that as we're seeing our vaccine rolling up, as we're heading towards 60% and getting close, and maybe hopefully getting past there fairly soon, as we see our numbers coming down, maybe hopefully today even under 2,000, we're getting more optimistic about the range of outdoor activities. Our science table has given us advice on the increasing ever more on our outdoor activities. It's a matter of can some of them be done and still maintain the adequate public health measures to avoid congregate or close activity. I think some of them have and could do that, and especially I think people are more aware of that and knowledgeable and would, I think, persist or really make a diligent effort to not do that in those activities because they want them and they want to show that they are safe and can be safe. So we're looking seriously at those at this time, and we hope to have some news and updates in the near future on that. So like the minister said, we're optimistic and we're going to look at that, and assuming that our people in Ontario will continue to use all the precautions they need to according to our public health measures.
Follow-up?
Thank you for that, Doctor. Just wanted to switch now to the B1617 variant. Earlier this afternoon, Toronto's medical officer, Eileen Davila, was talking about how they've more than doubled in the UK. The number of Indian variants have more than doubled in the last week in the UK, and she was sounding some very cautionary notes there, such as it may be more than, or it may be half as contagious again as the B117 variant, which is now dominant in Ontario. So, where are we with this new B1617 variant? What's the latest research? What's the danger given the level of vaccination that we have here in Ontario, and what do people need to keep in mind?
Well, that's the question we're looking at, and we're talking with our consultants both at the federal level and at the provincial level with our public health laboratory. We're asked them to look at, as we said before, it's moved from a variant of interest to a variant of concern. That was just last week. And we're trying to get some better data from other centres. It's been fairly limited, even from the UK. In that, we continue to look for the variants. We've seen some, mostly those that have had travel history from the Indian subcontinent. And we've been monitoring those through our travel history. As far as it compares to B117, we haven't got the data yet, the denominator, the size and numbers to do some real fair comparisons on that. We always want to know that. What should we do? How should we expect that to perform? So we're asking our lab to continue looking and testing for it. We haven't seen a large accrual of community cases here yet in Ontario. We don't want to assume that that would not occur. We want to make sure we're looking for it in there. B117 is still highly predominant, even dwarfing way over 135 and the so-called Brazilian P1 variant. So as far as its performance, even in the Indian subcontinent, we don't know because the data and testing sometimes is limited, and we need to have some better results from them, and we're hoping that they will be forthcoming with that to the WHO and on into our federal centers that we can add to our knowledge base in that. But we are looking, we're testing, we're trying to watch it very carefully, so we're not being casual about it. And with our travel limitations, so far a lot we've seen have been people who have traveled in from the Indian subcontinent, but we have that restriction on at the moment. And so we want to be very careful. I know the Premier is very concerned about our borders and maintaining as tight a control as we can with the current limitations on that. We'd really like to strengthen that up. And while some may come with that on them, we would like them to be quarantined properly, handle that. So far, we've had no information that the vaccine is not effective. But again, the numbers of testing on that is quite small at the moment. And we have a lot more to learn about it, to understand it, and to assess it. So we'll be updating the public on that as soon as we have more information that has been verified.
Next question.
Next question from John McGrath at TVO. Please go ahead.
Good afternoon, doctors.
with the AstraZeneca doses that we have on hand, there is a real concern that some of those doses could expire. I think the Minister of Health has conceded that some small number could expire. And, I mean, that seems like a real shame in a context where there are people who are ready to get their second doses basically now. What are we waiting for? I mean, is this why do we need to wait for NACI or Health Canada to follow a course of treatment that is more or less exactly what the manufacturer and what the regulator predicted?
Well, yes, thank you. And we're trying to work at that right now, how to assess that. We're trying to come up with our recommendations about second dose, as I alluded to last week. Right now, the position in science is that those who did not have an adverse event on the first have a very, very rare possibility of a VITT or TTS, as Dr. Yaffe's alluded to, on the second dose. So it would seem to be quite an excellent choice to make and have a second dose with AstraZeneca vaccine, knowing that you had no issues on your first dose, 28 to 42 days out. So we're watching that, and we know we don't have a lot on hand at the moment. We're expecting some more supply perhaps to arrive later this week. But we also want to answer a couple of questions. One is, what is the capacity for an informed consent of individuals who may want to choose to have an mRNA vaccine as a second dose? And we want to make sure that you have that option in front of you when you're going to make that choice, or your caregiver or your pharmacist, so that you're fully informed on that. We have, in fact, there's no severe adverse events of mixing the two. Right now, we don't know the actual vaccine effectiveness level or the immunological level of the two mixed. We're hoping to have an answer to that soon with some studies sometime early in June. That might be more informative. So there's a lot evolving. The challenge with the vaccine there is that is anyone close to it? As you know, with the AstraZeneca vaccine, the prime effect is you wait longer for your second dose. Beyond 12 weeks, you get the maximum benefit of the highest level of what we call immune response. The earlier you take it, it's a lower response. So we're trying to make sure that if we're going to let people use it as the second dose, how close can we get them to 12 weeks or beyond to do that? At the same time, I'm not willing to wait and give expired vaccine at all under any means to anyone in Ontario. That would be totally wrong. And so the fact that there's an expired vaccine, if we can't use it all, that was what we have to face. But we're going to try and see, can we utilize that in any way possible, in a safe way, efficaciously, and a way that's fully aware and knowledgeable, and with the proper protocols fall in place. Because for us, vaccine safety is utmost importance, and the results of that are critical. And we do not want to compromise our program in that light if we can't. And so we're looking at to come up with two things. One, how we might undertake to do that. And second, how we are going to inform you as Ontarians who have received your first dose about how to get your second dose. And again, I'm really looking forward to say that you should at least try and wait for 12 weeks, because that's when the maximum from the manufacturer's immunological benefit occurs. And we want to make sure you get the best protection you can for the long run. So we hope to have that detail out to you shortly. So far, we haven't got a lot of people that have reached 12 weeks yet, but we want to get that shortly out to you so you can make and prepare and get that arranged for your second dose when we give all the information for you, so you can have a fully informed consent on all the points I've raised thus far.
Follow-up?
In terms of the efficacy, there was a study out last week that showed that a similar sort of increase in immune response for people who waited, I believe it was up to 12 weeks for the mRNA vaccines. Previously, the government had said that as more vaccine supply came on hand, they would like to shrink the dose interval between, from current 16 weeks down to something closer to the manufacturer recommended 3 or 4 weeks. Is that still the case? Like, as we get more supply in June and July, is the government hoping to shrink the dose interval, or are you now thinking about maintaining the dose interval of several months, which would mean that we would still be giving people their second doses in October?
I'll let Dr. Yaffe start, and then I'll probably have a comment to add afterwards.
Yeah, thank you. Yes, I did see that study, and That was very interesting. There are lots of studies. We're learning more and more, of course, with these new vaccines, and that was heartening to see. At this point, certainly with the mRNA vaccines, we're booking people 4 months, but we're hopeful as the supply goes up and more people are getting their first shot, we'll be able to start having shorter intervals, particularly for frontline healthcare workers and people in certain high-risk groups, which I think we've already begun. So I don't see it becoming really short. We want to make sure people have enough of immune response to the first shot. And as we heard with AstraZeneca, usually if you wait a little longer, you get a better response to a booster, but we may not need to wait the full 4 months.
Yeah, I'd add that our decision on the 4 months with the rest of our PT partners, provincial territorial partners, was we wanted to get the maximum benefit in the shortest time with everybody getting one dose, especially the mRNA vaccines. And we have done that, getting up close to 60% shortly and hopefully going beyond that. That brings our numbers down. As we're seeing, we've gone to our hot spots, we've gone to our highest risk areas with more vaccine, and we're seeing Toronto and Peel areas coming down to levels they haven't seen for a while, and so that's encouraging. That was the reason why we went out to that period of time to get that to work. As we go forward, as Dr. Yaffe has alluded to, and we get lots of vaccine supply, we're not going to leave it in fridges. So if we're covering more and more people, we've got now our 18 and up, our full adult population, and then we've got our adolescent population to deal with later, which is about nearly 1 million, just slightly under that, to cover. So we've got these ones to cover. But if we feel that we can go on to second doses with people, we certainly will. We won't wait for the 4 months. And that's part of the advantage of the COVAX system. We can change the booking time if and when we can and are able to with supply. And that's been our main issue all along. We're trying to move as rapidly as we can to get as many first doses in as quickly as we can in all our areas, and hopefully with that to move on to a second dose as soon as we can. So that that discussion about 1 dose or 2 dose, we would like 2 dose definitely, but that depends on supply demand and how quickly we move through. So that's the reason why we did the 16 weeks, and we would like to do it sooner if we can. And that will all depend on those factors I just talked about.
Last question.
Last question from Adrian Gabriel at City TV. Please go ahead.
Hi, good afternoon, doctors. Just to follow up on the AstraZeneca stuff there. Dr. Williams, could it be inevitable then that if the Minister of Health, if yourself aren't going to move forward with getting these AstraZeneca shots into people's arms before the end of May, before some of the batch expires? I believe some of them also expire at the beginning of June. That they are going to go to waste? Is it an inevitability that we're going to waste some of these vaccines, that they're simply just not going to get used?
Well, if it goes past the expiration date, that would be true. And we're not giving vaccines that have passed expiration, so that's clear. And because we're dealing with less than 40,000 doses out of so far 7.1 million. We would like to try and use, if we can. That means if you go down too much below that, people have to understand that their overall immune response may be less than maximum in there, but some may say that's fine with me. That may be okay. So we're looking at how we might do that, but it all depends on where it is, because we're not talking about a large volume in one sense and spread all over the place. We don't like moving it from place to place a lot because risking of some what we call cold chain. So we do not want to compromise the quality of the vaccine. So it's not just a matter of there, it's a matter of where is it and where is it located, and can we utilize that in a way, first, that is effective, second, it's safe, the quality is maintained, and that the people receiving it fully understand if they're getting it before 12 weeks, what does that mean and how important is that to that person? Again, informed consent, but again, always safety and quality is a top priority for us throughout this process. That's been our priority throughout, and we do not want to compromise on that in any way. So we'll try to do what we can and utilize it, but expiration dates are expiration dates, and you have to hold to that rule, and you can't utilize it past that date if you can't.
Follow up, and this is the last question.
Just back to the outdoor rec sports and facilities remaining closed. Yourself, the provincial government have said repeatedly, when we're looking at, let's say, golf, for example, a lot of this is about, we don't want people going from region to region. But when it comes to the science, a lot of Ontarians are still frustrated with a lack of clarity. So I'll ask the question again. Do you have any scientific data that would suggest that X amount of people contracted COVID while playing golf or congregating at a golf course, or that X amount of people, let's say, playing tennis got COVID, and that is where the risk is?
At the moment, if you ask me in the third wave with our variants, the answer is we don't have the data because that hasn't occurred. So the golf courses have remained closed, and the tennis courts, much to our best control, are not being heavily utilized in that way. So I don't have data to support it because officially it should not be open, and those events should not be occurring in the time of our third wave with our variants of concern, which has been our main concern at this time. So more of the activity is what you're doing in and around that. How are you doing that tennis match? Is that with a whole courtside chat for half an hour with friends without masks on? What do you think? I think our people are saying we will be cautious and careful. We understand that. As well as with the golf, as I think the Premier is concerned more about the pre-golf and the post-golf congregate activity. I think if people put those precautions in place, so we're looking at how we might best utilize that. Crowding number of people into golf carts without proper protection. The other things to look at. So there's ways I think it can be done safely if everybody follows the rules and limits their contacts, because a number of people maybe not have even received their first vaccine yet, especially in a time there. So we're in changing times, and we hope to be able to look at that very seriously because we know people are eager to get out and do as much outdoor activity as possible. We would like that too. We just want it done safely. And so we don't build up any data. I don't want to see any cases accrued from golf courses or tennis courts or other things. So I'd rather not see that. And I think with the proper steps, the direction we're receiving from our science advisors, and with the proper things in the proper way, I think we can have a good, safe entry into summer, and to keep our numbers down, and to get wait for our vaccine, and to get full coverage. So all those things in line, even this coming long weekend, if we're just careful on it, wait a little bit longer. I know everybody's impatient, but we're going for the end game, which is a safe summer and looking at some return to normalcy at the end into the summer and into the fall. That's what we're planning to do. That's what we need to look at. So stay at it. Do what you've been doing. Thank you for all the work you are doing and for your ongoing patience. Even the weather's there. Get out, do what you can, and we'll try and open things up as soon as we can in a safe way.
Thanks, everyone.